Have you ever walked into a doctor's office for a routine checkup, only to be told something serious might be going on inside your body before you've even said a word? You didn't cough. You didn't complain. You were just there, sitting, smiling. Yet somehow, your doctor could tell. The truth is, your body is speaking volumes through little signs you might not even notice. And for many older adults, these quiet signals are hidden in something we all think we understand: personal hygiene. Now, I know what you're thinking. I've been taking care of myself for decades. I know how to stay clean. But here's the hard part. Sometimes it's the small, seemingly harmless habits that quietly point to bigger health problems. And sadly, many of us don't realize we've been making mistakes until it's too late. Let me tell you about Mr. Harold, a 75-year-old retired engineer from Ohio. He played golf every Sunday, cooked dinner for his grandkids every Friday night, and kept his calendar full with community events. Harold was sharp, independent, full of life. So when he sat down for his annual physical, he wasn't worried. But his doctor noticed 3 subtle signs, tiny details in Harold's appearance and routine, that led to a diagnosis Harold never expected: early-stage heart disease and warning signs of a neurological disorder. His hygiene had been giving off clues, not bad smells or obvious neglect, but small changes: gum inflammation, dry skin patches, and a shift in nail color. Harold later said, "I thought I was doing just fine. I had no idea those small things could mean something so serious. My doctor probably saved my life that day." And Harold isn't alone. Across the country, doctors and caregivers are trained to spot what most of us overlook: the hygiene mistakes that quietly whisper that something inside isn't right. In the next few minutes, I'll walk you through the 7 most common personal hygiene mistakes that doctors notice immediately in elderly patients, and more importantly, how to fix them with simple changes that can protect your health, your independence, and your dignity. These aren't just cosmetic habits. They are windows into your heart health, brain function, immune system, and even your emotional well-being. And the best part? It's never too late to start listening to what your body is trying to tell you. So let's begin. Not with fear, but with hope. Because knowing what to look for might just give you more time to laugh, more moments to cherish, and more years with the people you love. Mistake number 1, neglecting oral hygiene. Most people think of brushing their teeth as just another part of the day, like making the bed or turning off the lights before sleep. It's automatic, unremarkable. But what if I told you that your toothbrush might be quietly telling your doctor more about your health than your blood pressure ever could? Sylvia didn't think much of it either. She was 68, a retired school teacher, and someone who had always prided herself on staying active and alert. She volunteered at her local library and spent weekends baking with her grandkids. Like many people her age, she figured the occasional gum bleeding was just part of getting older, nothing to worry about. But during a routine heart checkup, her cardiologist noticed something off: subtle inflammation around her heart valves. The culprit wasn't stress or diet. It wasn't family history. It was bacteria, quietly entering her bloodstream from untreated gum disease. Sylvia had no idea that the mild symptoms in her mouth had been a warning sign, echoing from her heart. She later said, "I was brushing every day, but I wasn't really paying attention. I didn't realize my gums were trying to tell me something." She's not alone. Research from Harvard Medical School shows that older adults with poor oral hygiene are significantly more likely to develop cardiovascular problems. The connection is real, and it's often missed. What starts as bleeding gums or a worn-out toothbrush can evolve into a threat far more dangerous than a cavity. The danger isn't in neglecting a dentist appointment. It's in assuming that what seems small will stay small. If you haven't looked at your toothbrush lately, it might be time. If it's over 3 months old, if the bristles are splayed out like a tiny fireworks display, it's not doing its job. Many dental professionals recommend switching to an electric toothbrush for older adults. Not because it's trendy, but because it's more effective, removing significantly more plaque with less strain on the wrists or joints. And then there's flossing, that often skipped step that so many of us avoid. But between your teeth is where the real trouble hides. A daily flossing habit, done gently with the right tools, can be the difference between a clean smile and bacteria slipping into places it doesn't belong. Even if you wear dentures, regular dental visits still matter. Oral tissue can show early signs of health issues that affect more than just your mouth. People often think that losing a tooth or getting a little gum swelling is just aging. But the truth is, your mouth is a mirror to your internal health. It reflects what's happening deeper inside, sometimes before any other part of your body speaks up. Caring for your teeth isn't just about looking good or avoiding cavities. It's about listening. Your gums, your breath, the feel of your mouth. These are messages. And when you listen carefully, you can act early, prevent complications, and protect something even more vital than your smile. Because sometimes saving your life doesn't start with a big test or a scary diagnosis. Sometimes it starts with a toothbrush. Mistake number 2, infrequent bathing and skincare. As we grow older, routines shift. What once felt necessary starts to feel optional. And among the first habits many quietly let go of is bathing. Clarence, a 77-year-old retired postal worker from Michigan, used to be known in his neighborhood as Mr. Reliable. Rain or snow, he delivered the mail with a grin and a kind word for everyone on his route. After retirement, Clarence kept up many of his routines, but over time one began to fade. Bathing. In the colder months, he said his skin felt dry and irritated, so he cut back to once a week. "It's not like I'm going out every day," he reasoned. "I don't want to strip the oils off my skin." To him it seemed harmless, maybe even wise. But during a doctor's visit for what he thought was just some unusual fatigue, his physician noticed changes in the skin along Clarence's arms and lower back. Slight discoloration and texture shifts. Further tests revealed early signs of kidney disease. The irony was striking. The condition might have been caught weeks earlier had those skin changes not been hidden under layers of long-sleeve clothing and infrequent washing. We don't often think of our skin as a communicator, but it's the body's largest organ, and in many ways it's most honest. It reacts to internal imbalances, to inflammation, to disease. It flares, flakes, dries, discolors. These aren't just surface issues, they're signals. Infrequent bathing doesn't just mask these signs, it allows buildup of bacteria, dead skin, and oils that can complicate what's already a delicate balance. And for seniors, especially those managing conditions like diabetes or reduced mobility, that buildup can become dangerous. Still, the answer isn't to scrub harshly or shower daily like we did in our youth. It's about mindful care. Gentle routines, bathing 2 to 3 times a week with warm water and fragrance-free soap, can go a long way. Afterward, applying moisturizer while the skin is still slightly damp helps lock in hydration, especially for areas like the arms, legs, and back that often get dry with age. And then there's the importance of observation. When you bathe, take a moment. Look at your skin, not just in passing, but with attention. Notice changes, discoloration, patches that itch or won't go away, dryness that feels deeper than usual. These aren't just quirks of aging. Sometimes they're the body's earliest cry for help. It's easy to believe that aging means fading, that rough skin or random rashes are just part of the process. But many internal health issues, from liver conditions to heart disease, begin with changes you can see and feel long before they show up in a blood test. Clarence made changes. He didn't start bathing every day, but he did start looking, really looking. His doctors caught his condition early, and with treatment and lifestyle adjustments, he's back on the golf course twice a week and says his skin feels better than it has in years. Caring for your skin isn't about vanity. It's about awareness. It's about reconnecting with your body and giving it the care and the attention it quietly asks for. And sometimes the first step to protecting what's inside is washing what's outside. Mistake number 3, ignoring nail care. We rarely think of our nails as anything more than something to clip when they get too long. They're small, easy to overlook, hardly the kind of thing we'd associate with serious health concerns. But for doctors, nails are one of the first places they look, because tucked beneath that small curve of keratin can be some of the earliest, most revealing clues that your body's trying to tell you something. Beatrice, an 82-year-old widow living in a quiet retirement community in Northern California, hadn't worn open-toed shoes in years. Her toenails had thickened and turned yellow, and it embarrassed her. She stopped painting them, stopped showing them. Eventually, she just ignored them. "I figured it was just age," she said softly. "Old feet, old nails. What do you expect?" But when foot pain forced her to visit a podiatrist, what he found wasn't just a fungal infection. It was a symptom of something far deeper. Her immune system was underperforming, and further tests revealed an underlying autoimmune condition that had gone undetected for years. All that time, her body had been signaling trouble through her toenails. She just hadn't known how to read the signs. It's easy to dismiss changes in your nails as cosmetic, but brittle, discolored, ridged, or thickened nails can indicate more than just aging. They can be linked to heart disease, thyroid imbalance, anemia, circulation problems, and more. In fact, in nearly 1/3 of elderly patients where a new internal condition was diagnosed, unusual nail changes were among the first visual clues doctors noticed. It's not just about what your nails look like. It's about what they say. That's why nail care is about more than appearance. It's about paying attention. Start by taking a real look. Are your nails yellowing? Do they feel thicker than they used to? Are they splitting or unusually soft? Do your fingers or toes feel numb, sore, or unusually cold? Make trimming a regular habit, not a chore for when they start to snag, but a gentle part of your self-care routine. Trim straight across with a slight curve at the edges to prevent ingrown nails. Keep the areas under your nails clean and dry. Change socks daily and wear breathable shoes to protect your feet. And don't ignore your toenails just because they're harder to reach. They deserve as much care as your hands, if not more. If bending down is difficult, ask for help or schedule routine visits with a podiatrist. Many clinics even offer in-home services. Beatrice now does her nails every Sunday while listening to classical music, something she calls her ritual of respect. Not just for vanity, but as a way of checking in with her body, of noticing what's changed and what still needs care. Your nails are more than a finishing touch. They are messengers, quiet ones, but the kind that, when listened to, can help you stay ahead of problems that are easier to prevent than to fix. So look down, look close. What are your nails trying to tell you? Mistake number 4, improper incontinence management. This one is difficult to talk about, not because it's rare, but because it's so common and yet so deeply hidden behind closed doors and quiet shame. Incontinence affects over half of all adults over 65, and yet you wouldn't know it. Most people won't mention it to their spouse, much less their doctor. They cover it with layers of clothing, with carefully timed bathroom trips, or by avoiding social events altogether. That's exactly what Douglas did. He was a 73-year-old retired accountant living in Arizona, sharp-witted, always punctual, and meticulous in everything he did. But behind closed doors, he was dealing with something he didn't even feel comfortable naming. He started using paper towels in his underwear, just in case, and kept a spare set of clothes in his car. When accidents happened, he'd brush them off, change quickly, and move on. The worst part wasn't the inconvenience. It was the fear someone might notice. It wasn't until painful sores began to develop that Douglas finally sought help. And by then, the doctors discovered something far more serious. An advanced prostate condition that could have been treated far earlier had he spoken up. His silence, his discomfort in asking for help, nearly cost him his life. He later told me, "I thought I was handling it, but I was hiding it." There's a difference. What many people don't realize is that incontinence, whether it's occasional leakage, urgency, or full loss of control, is often a symptom of something else. It can point to infections, neurological issues, even certain types of cancer. But if we treat it like a personal failing or a secret, we miss the chance to catch these conditions early. The first and most important step? Let go of the shame. Doctors talk about bladder issues every single day. To them, it's no more awkward than checking your blood pressure. They want to help, not judge, and in most cases, they can. There are products designed specifically for incontinence, not paper towels, not tissues, but medically tested pads and garments that are discreet, breathable, and much safer for your skin. Using the right supplies can prevent infections, reduce odor, and give you peace of mind when you're out in public or sleeping through the night. Just as important as protection is cleansing. When accidents happen, cleaning the skin thoroughly and gently is key to preventing irritation, rashes, and more serious complications. Even mild incontinence, when left unmanaged, can break down the skin over time, especially in warmer areas of the body. But none of these changes are possible until we stop pretending incontinence is something to hide. It is not a weakness, it is not a personal failure, and above all, it is not something you have to navigate alone. There's a quiet kind of strength in asking for help, in saying, "This is happening, and I want to do something about it." That strength can save you from pain, from illness, and from the slow erosion of dignity that comes when you're afraid to leave your own home. Douglas now speaks openly about his journey. He gets regular checkups, uses proper protective garments, and hasn't had a skin flare-up in over a year. He told me something I'll never forget. "The day I talked to my doctor wasn't the day I lost control. It was the day I took it back." If you're changing your habits, avoiding outings, or adjusting your life around the fear of leakage, it's time to reclaim your confidence, your health, your comfort, and it starts with a conversation. Mistake number 5, ear hygiene errors. Some habits feel so ingrained that we never think to question them. For generations, cleaning your ears with a cotton swab has been seen as good hygiene, almost a sign of being well kept. You twist it gently, maybe after a shower, thinking you're doing something right. Clean ears, clean body. But here's the hard truth. What feels like a harmless routine could be putting your hearing and your health at risk. Patricia, a 71-year-old retired librarian from Washington, had always been careful about her appearance. Neat hair, pressed clothes, polished shoes. Cleanliness to her was a form of dignity, and that included her ears. She used cotton swabs every morning, pushing a little deeper than she should have, wanting that squeaky clean feeling. One morning she felt a sharp pain, then a rush of dizziness. By the afternoon, there was a discharge she couldn't explain. When she finally went to urgent care, the diagnosis was immediate. She had punctured her eardrum. And worse, a secondary infection had begun spreading into the surrounding tissue. No one had ever told her that swabbing deep inside the ear canal wasn't just unnecessary, it was dangerous. The truth is, your ears are self-cleaning. They're designed that way. The wax you remove so diligently actually serves a purpose. It protects the ear canal from dust, bacteria, and irritation. Pushing anything inside, even gently, often does more harm than good. It pushes the wax further in, compacts it, and increases the risk of blockages, infections, and in some cases, permanent damage. What's more, changes in your ears can be early signs of something deeper. Feeling pressure, hearing loss, discharge, or pain could signal infection, nerve damage, or even medication side effects. But when we assume it's just wax buildup, we often miss the chance to catch something important. So what should caring for your ears actually look like? Simple, gentle, respectful. Use a warm, damp washcloth to clean only the outer part of your ears, what you can see and touch comfortably. If you feel like there's buildup deeper inside, resist the urge to handle it yourself. There are over-the-counter drops that can help soften wax naturally. And if discomfort continues, see your doctor. Audiologists and ENT specialists can safely clean the ear canal if needed, without the risks of at-home digging. Another red flag is itchiness. Many older adults experience dry ears, especially in winter, but scratching with hairpins or swabs often makes it worse. Sometimes a little bit of natural oil applied to the outer ear, never inside, can soothe the skin. But chronic itching or flaking may point to an infection or eczema, and that's something best left to a professional. Patricia eventually healed, though her hearing didn't fully recover in one ear. Now she shares her story whenever she can, hoping others won't repeat her mistake. "I just thought I was being clean," she said. "No one told me my idea of hygiene was actually hurting me." Sometimes the habits we're proud of, the ones we've done for years, are the ones worth examining the most. Because taking care of yourself doesn't mean doing more. It means doing it right, gently, wisely, and with the understanding that your body often knows how to care for itself if you let it. Mistake number 6, poor foot hygiene. There's something almost poetic about the way feet carry us through life. From childhood adventures and long work days to dancing at weddings and pacing the floor during sleepless nights, your feet have been there for every chapter. But with age, many people stop looking at them. Really looking. They become the most forgotten part of the body, hidden away in socks, slippers, or orthopedic shoes. Raymond, a 76-year-old retired factory worker from Illinois, told me that for years he just accepted that his feet were rough. They'd been through a lot, he said. Calluses, dry skin, some numbness. I thought it came with the territory of getting old. He only brought it up when his doctor noticed a patch of skin on his heel that looked oddly discolored and slow to heal. After some tests, Raymond learned he had early-stage diabetes. The dryness and numbness in his feet weren't just aging, they were signs of reduced circulation and nerve damage beginning to take hold. The thing is, your feet aren't just the base of your body, they're a map. They reflect your blood flow, your nervous system, and even your immune function. And for older adults, they can often be the first place where serious health issues reveal themselves. Doctors trained in geriatric care often check the feet before anything else. Why? Because signs like persistent dryness, open sores, coldness, or lack of feeling can point to serious issues like neuropathy, vascular disease, or complications from diabetes. And yet so many of us overlook them. We wash our faces, brush our teeth, maybe apply lotion to our hands. But our feet? They're lucky to get more than a rinse in the shower. That needs to change. Caring for your feet starts with presence. Take the time, even once or twice a week, to sit somewhere comfortable and give your feet a few moments of attention. Not just a glance, but a true check-in. Wash them gently but thoroughly, making sure to clean between the toes. After drying, inspect them. Do you notice any cuts, flaking, blisters, or color changes? Is one foot colder than the other? Are your toenails too thick to trim easily? Are there spots that don't feel anything when you touch them? These aren't cosmetic concerns, they're medical clues. And here's something most people don't know. Up to 85% of diabetes-related amputations could have been prevented with simple, regular foot care and inspections. That's not a hopeful guess. It's a proven, documented fact. After washing, apply a gentle moisturizer to dry areas, but avoid putting lotion between the toes. That space needs to stay dry to prevent fungus. Wear clean socks made from breathable material and change them daily. And if you notice anything unusual that doesn't improve in a few days, don't wait. Talk to your doctor or a podiatrist. Raymond now checks his feet every morning when he puts on his socks. He calls it his 10-second insurance policy. And that habit has kept his diabetes in check and his mobility intact. Because the ability to walk confidently across a room, to feel the ground beneath your feet, and to stand tall in your own home, that's not something you want to give up easily. And with a little care, you won't have to. Mistake number 7, medication-related hygiene issues. Barbara always prided herself on being the clean one. A retired nurse from Florida, she had spent most of her life caring for others, making beds in hospital wards, reminding patients to drink water, and gently brushing their hair before families arrived. Even in retirement, Barbara kept her habits sharp. She bathed regularly, wore crisp clothes, and never missed a morning routine. So when her daughter quietly mentioned that Barbara's body odor had changed, something a little sharp, unfamiliar, she was stunned. I took offense at first, she admitted. I thought, I shower every day. I wear deodorant. What more could I be doing? But it wasn't about neglect. It was about something much more invisible. Her doctor gently explained that the change in odor was likely linked to a new medication she had started a few months earlier. It had been prescribed to regulate her blood pressure, but one of its lesser-known side effects was liver stress. Her body was trying to communicate not through pain or fatigue, but through scent. This is something few people talk about, how medications, even the ones saving our lives, can sometimes quietly shift the way we smell, sweat, or even how our mouths feel. It's subtle at first, a bit more dryness, a strange taste, a new kind of perspiration that doesn't quite smell like your own. And it's easy to misinterpret these changes as poor hygiene, aging, or just the way things go. But often they're early indicators of how your body's reacting to your medication, and whether it's time for a closer look. Dry mouth, for example, may seem harmless, but it can increase your risk for gum disease and tooth decay. Excessive sweating or changes in body odor could point to how your liver or kidneys are metabolizing your medication. And in some cases, these signs come long before more serious symptoms arrive. What's important is not to guess, or worse, to feel ashamed. These effects are not your fault. They're chemical reactions, not character flaws. And the sooner they're brought into conversation with your doctor, the easier they are to manage. Barbara began keeping a small notebook. Nothing fancy, just a few lines a day, noting when symptoms flared, what she ate, how she felt, and what changed. Within weeks, her doctor was able to adjust her dosage, and the strange odor faded. More importantly, her liver enzymes stabilized. A simple observation may have prevented a much bigger health crisis. If you've recently started a new medication, or even if you've been on one for years, pay attention to changes in how your body feels and smells. Has your skin become unusually dry? Are you sweating more than usual? Is your breath or body odor different, even with your usual routine? These aren't trivial issues. They may be signs that your medication needs adjusting. And above all, never make those adjustments on your own. Even if you're sure the pill is the cause, the solution is never skipping a dose or halving it. Every medication works in a delicate balance, and only your doctor can help you find the right one for your body at the right strength. Barbara still keeps that notebook, not because she expects more problems, but because she's learned that listening to your body isn't paranoia, it's wisdom. Because sometimes the first sign that something's not right isn't a test result or a doctor's word. It's you, noticing something small, in choosing not to ignore it. The quiet power of paying attention. We often think that taking care of ourselves means doing something big, starting a new diet, joining a gym, or going through stacks of medical tests. But more often than not, the power to protect your health begins in the smallest places. In a toothbrush, a dry patch of skin, a thickened toenail, a quiet shift in the way your body smells. These aren't just hygiene routines. They're conversations your body is trying to have with you. And if you listen, really listen, you can catch things early. You can avoid complications. You can live longer, more comfortably, and with the dignity you deserve. Let's be clear. Aging doesn't mean losing control. It doesn't mean becoming invisible. And it certainly doesn't mean you stop mattering. Your body is still your home. It still speaks to you. And it still wants to be heard. You don't need perfection. You don't need to overhaul your life. What you need is presence, curiosity, a willingness to care for yourself with the same love you've given to others for decades. Harold, Sylvia, Clarence, Beatrice, Douglas, Patricia, Raymond, Barbara. They're not just examples. They're reminders that every day we delay listening, we give disease a little more room to grow. And every day we act, even in small ways, we take back a little more strength, choice, and freedom. So here's the invitation. Start today. Pick one habit. Look a little closer. Ask one question. Replace one tool. Have one conversation you've been putting off. Because when it comes to your health, small things aren't small. They're the early steps toward longer walks, fuller breaths, deeper rest, and more memories. You are still writing your story, and every gentle act of care is a way of saying, I'm not done yet.